Hey everyone, what is going on? Dr. VetTriage here. We're going to talk about a really cool case we saw recently in VetTriage. This arrow is pointing to a liver in a dog, liver and gallbladder. So that green thing is the gallbladder, and the rest is liver. And we had a really cool case in VetTriage as a second opinion. It's concerning liver disease, actually. Very cool because it's very common. And it can be everything from a mild to actually quite dangerous. So we'll talk a little bit about that. And basically, the focus is going to be on what do you do if your dog is found to have high liver enzymes. And that's a very, very common scenario that we see all the time. In fact, this particular call was a second opinion after another vet diagnosed high liver values, and the pet owner wanted to know what to do. So check out the video. The most common way that we end up finding liver enzyme elevations is actually on routine screening. So you'll see your veterinarian and they'll do their blood work and you'll find out that the liver values are high. Now, what does that mean? Well, there's a couple of blood values on a blood panel that come routinely, and this is specifically going to be for dogs and cats. That if these values are elevated, it tells you something is going on with the liver. You can probably categorize these blood values into two categories. One is liver enzymes that leak because of liver damage. They leak from liver cells called hepatocytes. And the second category can be probably put underneath the title of liver function values. So not necessarily leakage enzymes like you see with liver disease, where they leak out of the cells, but more of the liver isn't doing its job, then you end up having liver malfunction. And so that'll be depicted by certain values on the blood panel. Going into each and every value is a topic for another time. However, what we can do is talk about in broad generalizations as far as what do you do if that's found. And every veterinarian is going to have their own experience with this, their own methodology behind attacking this. But my job is to let you know what you can do to further evaluate what's wrong with the liver in my dog. You may find this on accident, like I said, on routine screening, or it may actually be part of a disease process, in which case your dog is actually sick. And the liver can be the primary source of problems, or it could be afflicted secondarily from something else. And so if you found out that your dog has high liver values, there's a couple things you can do. You want to know, of course, what's wrong with the liver and should anything be done about it. And then, of course, from there, what is the prognosis? So if liver values are high, you can do a couple of things. Number one, if your dog is feeling fine and you're finding this sort of incidentally, well, then recheck the values in maybe a month or two and find out. 4 to 6 weeks is a good time to check liver values and see if the values have gone down. A lot of the liver enzymes, the leakage enzymes, have a half-life of about 2 weeks to 3 weeks. And so if you wait 2 or 3 weeks, in theory, if the liver had some sort of transient problem with them, they'll decrease by 50%, roughly speaking, every 2 or 3 weeks. So that's a good way of finding out whether or not you need to chase the liver values or not with further testing. There are veterinarians that will place the pet on treatments in the meantime, usually a liver supplement that helps with liver support. The second option you have is, if you want to be a little more aggressive with finding out what's going on, or if your pet actually is sick, is some kind of imaging. And imaging being either x-rays, which is okay for liver, but really the imaging I'm referring to is abdominal ultrasound. And in fact, more and more now we're using CAT scans to look at liver as well. So x-rays, abdominal ultrasound, or CAT scan are three ways that we'll use, three imaging modalities that we'll use to figure out what's going on with the liver, basically looking at the liver structure and see if there's anything going on there. This gives you a lot of information. It tells you the architecture of the liver is normal. It tells you what the gallbladder is doing. It also looks at other organs in the body, in the abdomen, to see if there's anything else that can be related to the liver. The liver is a very, very important organ, and it does lots of things. And one of the biggest things that you may already know about with the liver, it cleans the body, toxins. So it's constantly getting hit every day with toxins. That if you have a normal liver, you never know the difference, right? As a healthy person, or healthy dog or cat, you'll never know. But if the liver is not doing its job, something is wrong with it, then of course you get sick. And so we'll look at x-rays, abdominal ultrasound, or CAT scan to see what's going on with the liver. and you kind of use that information in conjunction with the liver values and the blood work and figure it out from there. As a side note with the blood values, there's routine tests that we perform, and there's also more specialized liver tests. And so your veterinarian can decide what they want to do with regards to that. That these may be blood work, maybe urine. There's different tests that we can perform to sort of elaborate more as far as what you're seeing on the blood work from the elevated liver values. And then finally, probably one of the best tests we have is liver biopsy. You either collect cells from the liver. You can do that either with a biopsy, like getting an actual piece of liver, or you can collect cells through a fine needle aspirate, a thin needle, and see what the pathologist, which is a specialist that'll look at liver cells under a microscope, see what they think about it. And that's probably the best test you have. Of course, as you can imagine, it is the most invasive test too. And there's risks involved with that depending on what you're looking to do, either a liver aspirate or liver biopsy. There are pros and cons to each modality. And since the liver is a huge organ in terms of actual healing of the body, well, if you're going to do a test like that, you need to make sure that the body can actually heal from collecting those samples. But that is a great test because you're looking under a microscope to see what is going on with the liver on a cellular level. And that tells you a lot of information. And so between the blood work results, the imaging modalities, and of course sampling the liver, you'll have a very good idea as far as what's going on with your dog or cat's liver. These tests are quite common. As you move up the complexity, your veterinarian may not feel comfortable or may not have the equipment or skill set available to run these tests, in which case, if it gets to the point where your veterinarian is no longer comfortable, they'll refer you to another veterinarian, a specialist, who can follow up with further testing. Not every pet, like I said, with liver value elevations on blood work is actually ill. Not every pet requires treatment for these values being elevated. So there's different ways we can go about attacking this depending on your individual case. If you are ever in any doubt for what you are hearing from your veterinarian, or what you're finding like online or talking to other people isn't really jiving with what your veterinarian is recommending, well, you can get a second opinion. And so a VetTriage is a novel, real-time, two-way video and audio conferencing software that will allow you to get a second opinion. Nothing wrong with talking to another professional and finding out what their point of view is. Veterinarians are hit with liver disease all the time. It's very common, and so there's more than one way to approach them. But again, I hope this video sheds some light as far as more of a routine that we typically will go through. Obviously, what exact blood values are abnormal, what exact abnormalities we see on imaging, what does your biopsy or fine needle aspirate actually show the liver. Those are immense details that people write whole books on, and we'll cover in future videos, but hopefully they give you some good insight. So check it out. Thank you everybody for paying attention to this video. Feel free to subscribe, share, like, all that good stuff, and we'll see you in the next one. That's liver disease in dogs and cats, and this is Dr. Shadi Arafij. Thank you so much. We'll see you in the next.